Good afternoon, everybody, and welcome to Considerations for Using Mobility Mentoring in Child Welfare Settings. My name is Ruthie Liberman, and I'm the Vice President for Public Policy at EMPath, and I'm really excited to welcome you all to this session. We're very lucky today to have two individuals who are both representing exchange members who are doing extraordinary work setting up programming in the child welfare area, child protection, family support, and integrating mobility mentoring into their models. And so I want to introduce you to our two panelists. First, we have Lorraine McGirt. She's the Program Director for Achieving Reunification Center, ARC, which is in Philadelphia. And Lorraine has worked for over 20 years in the nonprofit sector, devoting much of her time around youth development. She has been a program director for the YMCA's Black Achievers program. She has worked for the City of Philadelphia Human Services, working on after-school programming and summer programming. And has done many other interesting things. I wanted to highlight that she was recognized by Ebony Magazine for her many years of working with youth in the sports-based area. And secondly, I want to introduce Liz Wolkomir, who goes by Liz. Liz also has had a great career in the human service space, working with families, both from the perspective of the New York City agencies, where she is currently the Associate Commissioner for Community-Based Strategies. And as we all know, New York is almost bigger than most countries. So that's been quite a significant experience. Liz has also worked at the federal level in the White House Office of Management and Budget. She has worked for research and advocacy organizations and has had some great experience, which has informed her work creating an amazing project in New York City that she's going to be talking to you about. So without further ado, we're going to start with both of our panelists telling you a little bit about their programs. We're going to start with Lorraine, and she's going to tell you about her work.
Thank you. So the Achieving Reunification Center is a center-based program, and we promote family reunification through the delivery of supportive services to birth parents and approved caregivers whose children have been removed from their care due to safety concerns. The parents participate in short-term parenting, work readiness, behavioral health, financial education, housing, and case management supports for 6 to 12 months. ARC, the Achieving Reunification Center, we refer to it as the ARC, originated out of Philadelphia's effort more than 15 years ago in response to federal mandates to reduce a child's length of stay in the foster care system. Our organization is part of a larger network of Philadelphia Child Protection Services, courts, and service providers who are committed to ensuring a child's safety and well-being.
Thanks, Lorraine. And now we'll ask Liz to give us a brief introduction.
Absolutely. Good afternoon, everyone. Such a pleasure to be here and to be on this panel with Lorraine. I, as Ruthie said, am with New York City's Child Welfare Agency in our Division of Prevention Services. And in New York City, prevention services is such a core part of the work that we do in child welfare. They are free services that families can participate in voluntarily, where families require some support, whether that be in terms of concrete needs, case management, building some parenting strengths, or whether there are sort of more intensive needs for clinical or therapeutic care and support. The main goal of prevention services is to make sure that we can mitigate the risks of children being removed from caregivers' homes and biological parents' homes and placed into foster care so that we can keep families safely together and find ways to strengthen that system so that families can thrive and so that children can thrive. prevention services in New York City has grown tremendously over the last decade plus. Currently, on any given day, we serve about 24,000 children across the city, and we have had tremendous impact in reducing foster care placement in New York City, in large part as a result of this expansion of prevention services. We're going to talk in more depth, but we really continue to try and innovate and move towards a family-centered approach in prevention services, and mobility mentoring and the project that we're taking on with EMPath and some agency partners is an enormous part of that work, to really think about going beyond not having families engaged with child welfare, but also helping them set and meet goals so that they can thrive.
Great, thank you both. And I just want to mention that we're going to try and leave ample time for questions, but I would like to invite you also to join us for our breakout session at 3:15, which is going to continue this conversation, and both Lorraine and Liz are going to be able to join us. So if by any chance we don't get through all the questions, we'll have a chance to talk more about it and hear from all of you on this call. But let me just start with the question first to Lorraine and then to Liz. You're running this program that is dealing with such important issues for families, child safety and well-being and protection. And you, I'm sure, have many different requirements that you have to follow. What led you to decide that you wanted to do mobility mentoring on top of all this? Now you've got that bridge to self-sufficiency and the 5 pillars to deal with. Didn't you already have enough on your plate in your programs? So let's start with Lorraine.
So yes, you're right. That we struggle a lot with trying to balance compliance and having a parent-centered approach in our work. But in recent years, there's been more attention to the impact of poverty on healthy family functioning. And the research was showing us that family income inequality is a contributing factor in many cases to child maltreatment and neglect. I want to make sure, though, that we're clear that when we make statements like that, we are not in any way saying that families that live in poverty abuse their children. That's not what we're saying. But what we are saying is that there's a likelihood, a greater likelihood, that those families that are living in poverty, those children may experience some neglect. And so thinking about that, at ARC, many of our parents were either experiencing poverty or they did not have the income to reach self-sufficiency. And what is really interesting, though, as we began this journey, is that we understood that our parents were really experiencing difficulty in meeting their basic economic needs, like paying for rent, food and utilities. But we were using interventions that we felt didn't acknowledge the impact of poverty on their current situation. Prior to mobility mentoring, our organization used a case management approach where our staff would work to coordinate a range of distinct services based on client needs that were referred to us from Family Court. And our only goal was to ensure that those individual independent services were provided to the person as a whole. So we didn't have a person-centered approach in our work. In that process, what we began to see was that there was a clear distinction between the parent need and the problems from the broader context of poverty. So those same problems that brought a lot of our parents into the system and resulted in their children being removed from care, we weren't addressing them. In research, there's a reference to what they talk about as a poverty paradox, where social workers work with people who are poor, but there is a poverty blindness. And that was exactly what was happening to us at ARC. About 2 years ago, our funder, which is the Philadelphia Department of Human Services, challenged us to identify an evidence-based intervention to deliver ARC services. So we began to consider the increasing poverty rates in a larger community. At that time in Philadelphia, the poverty rate was about 25% of those that were living in poverty was about 25% of the entire population. We also looked at the parallel increase in our service requests. So we were seeing a higher increase in requests around concrete goods. So housing, many of our parents were experiencing unemployment. And we were also interested in balancing the need to follow procedures, ensuring compliance to meet the expectations of our funder, but we really wanted the ability to work with our parents in a more relational way. And finally, we wanted to address the high number of parents who initiated contact with ARC. They would enroll in our services, but they did not complete the recommended services. And this was really interesting to us because our services were free. We incentivized our services. We worked really, really hard to create a warm and a nurturing environment. We provided transportation, childcare support. Staff were very, very enthusiastic and had gotten really high marks in how they were interacting with the families, but it just didn't maintain parents and services. So we feel like what mobility mentoring does for us is it positions ARC to address many of the considerations that I've talked about. We feel like the coaching model and that opportunity will help us to work collaboratively with those parents to set goals. And that's important to us because it helps us to be intentional about putting the parent at the center of the work and making sure that they have a voice in the work. It reflects the city's commitment to making sure that we're ensuring a strength-based approach to our work. So that was important to us. A key feature though, for us with mobility mentoring is the growth mindset. And what this does is position our staff to move beyond celebrating the progress that the parents are making, the fact that they are coming voluntarily for services, right? But it highlights now the learning and the progress that they're making along the way. And it makes the goal of children returning back home to them more realistic, more achievable.
Lorraine, thank you. You really put a lot into thinking about why mobility mentoring. And I know that Liz in New York City has done the same because we started working with them probably 2 years ago. So Liz, why don't you add anything that might be different, and then I'm going to have you start next time first, okay?
Fantastic. Yeah, Lorraine said so much of what was on our minds and in our thinking, to Ruthie's point, which I don't think needs to be repeated. I will just say that from the New York City Administration for Children's Services perspective, we were thinking about this from the funder perspective. So Lorraine's funders gave her a charge. We as funders of a very large system sort of sought that same charge in partnership with the provider agencies that are out on the ground doing the type of work Lorraine's doing. I mean, I think it does, there is value in repeating the fact that in child welfare, we need to be laser focused on what the root causes of what brings families into our system are and addressing those. And we know that one of the places in New York City, and I think across the country, where we need to push further is to really addressing the underlying issues of poverty, because families should not find themselves at risk of losing their children or unable to support their children because they are facing poverty. And so what was so appealing about this model to us is the opportunity to do that, to really work with families, not just on addressing immediate symptoms of poverty, but on creating the skills to set goals and achieve them, and a bridge that lives with families over time. I think the sustainability and sort of the long-term vision of mobility mentoring for equipping families with the agency to shape their destiny beyond their journey and connectivity with the child welfare system is so, so powerful. And I think that's really what made us lean into this particular model of addressing economic mobility.
Great, thank you. And so, Liz, I know that New York City and I'm sure Philadelphia, you collect a lot of data and set goals and have outcome measurements. Is there anything different that you might expect in your outcomes? I know you're early in your implementation, but kind of what's your hope and your dream in terms of what the outcomes will be once mobility mentoring is fully integrated into your programs?
Yeah, I mean, I think there are a number. One is that we always look to see that families, families can come to our programs whether or not they have a child welfare investigation. So we are really invested in reaching families and offering services to families before they are in the kind of crisis that brings them into child welfare. So we want to make sure that we're doing that and look critically at what families we can reach in that space and make sure that we have an equitable approach there. But we also want to make sure that if families are coming to us because they've had an investigation, a child welfare investigation in their life, that they aren't returning to our system. And that's universal. That's something we look for across all our systems. But we also know that families want more for themselves and their children than just not being engaged in child welfare. And so really looking at the ways that mobility mentoring helps move families forward and creates opportunity for them, whether it be through income, through job security, is something we really want to focus on. And I'll be transparent that we have a lot of work to do to figure out how do we understand once families sort of leave us, how well they're doing. But I also think we need to make sure that we are hearing directly from families and not only relying on numbers data, but there is power in family voices. So we want to know whether or not families not only have longer term outcomes, but if they feel while they're in services that they had more agency in their experience and goal setting, rather than a system that is prescribing goals for the trajectory of their family in which they're the experts.
Great, thank you. And Lorraine, what about you? Do you have any different outcomes or results that you're anticipating you'll see down the road as you implement mobility mentoring?
Yeah, so similar to Liz, because our funder is Philadelphia DHS, the long-term goal for us, our North Star, is to see fewer children re-enter foster care. If we see upward movement in this trend, what we think is that it's an indication that our parents are really making the kind of adjustments that we want to see them make in terms of being able to keep children safe and improve family functioning. We also feel like it's important because there will be significant savings to the cities and the states when we safely reduce the number of children that are they're no longer in out-of-home placement settings. And our hope is that we can then begin to have those kind of discussions on how we're using those savings now to make sure that we are supporting those families, once children come back home, and begin to look more closely at what those needs are and begin to invest in that way. And we do know that many of our families rely on subsidies in some way. So how are we now as a system really thinking about expanding that, for our families? So that's our long term, our North Star. For us, the short term is really making sure that our parents feel as if they can achieve that reunification. For many of the parents, when they meet us, is still a long way off. We're just one step in a long process. They're experiencing trauma, feeling maybe that they can't do it, or really feeling defeated. They're not feeling good as a parent. And so we really see a lot of our short-term work in helping them understand that not just that they can do it, but that it's okay with really thinking about it differently, taking risks, and being okay that it just may not work out. So those are the kinds of things in the short term that we really see that the mobility mentoring helps us to begin to work with our parents differently in that way. So our goals then would now reflect the fact that they are thinking about what can I do in the short term, and they are feeling a little more sense of control than what they came to us with.
It's great. So I know you're both in the early stages of bringing up mobility mentoring, but I'm wondering if there's any lessons that you can share about your planning and your getting started. In particular, Lorraine, one of the points you made about eventually saving money for the system, led me to wonder, are there any additional resources you've had to put into your programs to be able to do mobility mentoring, because that kind of work might require a smaller caseload than is normally happening. So what have you learned so far? What kinds of programmatic changes have you made that are different than how you were doing this work previously? So let's start with Liz on that one.
Sure. So I think, as Ruthie said, we're in early stages of implementation. We're working with 7 provider agencies. And I think a few takeaways. One is learnings not just from implementing mobility mentoring, but implementing, we have about 12 models across our system. So getting stakeholder engagement from all perspectives and levels is so critical. So we really intentionally, as Ruthie said, have partnered with EMPath and dragged them into a long-term contract with us so that we would have them at the table with our provider agencies as we think through what implementation means. We're also, as I said, hearing from our provider partners, and we'll be hearing from families on the ground as we begin to roll this out. We can't do this without understanding every step of the way if this is what's working for families. And in that vein, really being willing to entertain adaptation. Obviously, this model has research around it. We want to maintain fidelity to the core pieces of the model, but we all are coming from localities or service to particular communities or populations that have particular cultural needs, linguistic needs, and in many cases, and especially in the case of the child welfare context, may be carrying particular kinds of trauma, especially given the disproportionality of Black and Brown families in our system. So being willing to sort of get your hands dirty and know from the jump that you're not going to necessarily have a perfect picture of how this is going to work from day one, and entertaining those stakeholder voices as you work through that. I think the other really key thing, if you're working in any kind of system, whether it be from the funder, sort of public agency perspective, or the recipient of funding perspective, is really thinking through how these, as Ruthie said, sort of how the requirements, paperwork, framework in mobility mentoring fits into all of the other regulatory legal requirements, policies that exist, so that you can also be thinking about both the end user of the actual mentor and the end user as the service participant, so that you are thinking all along about efficiencies and synergies, and particularly from the family perspective, ensuring that you're only having the family have to tell their story once, so that we don't create a system where, because we have more forms, that we create an opportunity for re-traumatization. So those are the things that I think we are carrying into our conversations about the work. And I think just being willing, to fumble in ways that don't hurt families, but being willing to say, oh, I wasn't really quite right about the way that I was thinking about that.
Thank you. Thanks. And Lorraine, do you have something to add in terms of adaptations, lessons learned so far?
So for us, I think, unlike New York, we have just a little bit more room to focus on just one agency, right? So we would be one of those providers, and their multiple provider network. And I think for us, when we think about savings, what we found is that we need a lot more training. So we need to really think about, how are we preparing our staff to take this on? I mean, there are lots of new terminologies. We're talking about growth mindset. Many of our staff have already been trained and are really understand trauma informed. How are we now connecting, these different all of the different interventions that previously were introduced, and then how are we now really thinking about poverty? What does that really mean? And we're really changing practice. I think, and this is something we're changing practice that has been introduced to the field as a whole. If you look across a lot of the social services in general, case management is the approach. And so we're talking about something brand new. So I think just really taking a step back, looking at your organization, and for us really exploring our own biases about the people that we work with. That's key for us. We say we understand they're living in poverty, but many times we become so focused on the paperwork, getting the court report completed so that in family court, a family could be represented in a positive light, that we don't spend enough time with the parent to really understand their story and be able to make sure that parent is getting the kind of support, that relational that I talked about. So, and then what do we feel? Not just feel about the parent, but how do we work with them in a space and set goals that are really realistic for them and not reflective of what we think they should be or how we think they should be moving in the space. So those are all of the lessons that we've learned so far. There are a lot more I know coming for us, but that's where we are at this point.
Good. Well, make sure both of you keep track of those lessons, because we're going to continue the conversation with this group, and there's a lot of interest in the exchange in the topic of family support and child welfare. I have a couple more questions, but before I do, Rosemary, have any questions shown up yet in our chat or Q&A?
Not yet.
Okay, I do see one question from Stephanie, and it was actually, I'm going to add to Stephanie's question if she doesn't mind. So Stephanie asked, how are frontline employees as an important stakeholder group receiving this model? And I want to add to that, from my experience of meeting Lorraine and learning about your program and working really closely with New York ACS, it has struck me that in this family support child welfare space, staff are highly trained and experienced. You're really fortunate in many programs to have people who've had long careers, a lot of training, they know what they're doing. And now we're asking them to talk about stuff like income or debt or schooling. And this is not what they studied in school. And these are not the kinds of goals that they have done in these family reunification, family support. So I wanted to add that on to Stephanie's really good question. And why don't we start again with Liz and then Lorraine and talk about the employees and how they're accepting this shift, this broadening.
Sure. So it's early, but I would say there is inevitably going to be a requirement of a culture shift. And I don't just mean sort of organizationally, but in the way of doing work that Ruthie's talking about, because many folks have been doing a different type of work for so long. That said, I also think there's great excitement. I mean, you know, Ruthie, you can probably attest to this, but the providers in New York City, and, you know, I think this goes for across the country, frontline providers are deeply invested in the communities they work in. And so the idea that there's an opportunity to bring families to the center of the work and do something, implement a framework that has sort of more lasting impact in a family's life, I think is really, really compelling. The other thing is that in New York City, we asked providers to raise their hands and sign up to do mobility mentoring. So in that way, we have had agencies self-select into this framework because they had a number of choices. As I said, we implement a few frameworks. And so I think that alone has created good energy around figuring out how to make this work.
Yeah. Lorraine, same question.
Yes, so in full transparency, we introduced mobility mentoring to our line staff about 1.5 years ago, and it fell flat on its face. And so in thinking about it this time, and it fell flat on its face for all of the reasons that we've talked about, right? That these folks are highly trained, they're accustomed to working in one way, and we didn't make the connections for them in terms of why we should even consider doing it differently, right? So this time around, we've decided to take on mobility mentoring as part of our organization. So we're not just embracing this in the work that we're doing with the parents, but we're also embracing this as part of how we move with staff. And so we're really working closely with EMPath to talk about what does this look like? What does this coaching look like as supervisors are working with the line staff? So they have an opportunity to really practice it, right? And in doing that, it helps it to become part of their everyday practice, their everyday language, because they're using it themselves. And so we feel like this will be a great starting point. And it's also a good starting point for us as an agency to really see whether or not we can be committed to this, because how can we present something to families and, we haven't embraced them ourselves, and, we aren't modeling the principles, of mobility mentoring. So we feel if we approach the work this way, of really looking at our own selves and really challenging ourselves about our ability to even change, we will be more successful.
Thank you. That's a very thoughtful response from both of you. And I just want to add, at EMPath, we had that same experience in the beginning of somewhat falling flat on our faces, in some of our programs. And we recognize that parallel process that we talk about in all of our training. It has to go from the top to the bottom and the bottom to the top, with the leaders mentoring and coaching the management, the leadership, down to program directors, to supervisors, staff work with the families, and on and on. And as a result, we have begun to do mentoring within our organization. Beth Babcock, our CEO, holds mentoring Monday sessions. Anyone can sit and chat with her or other members of leadership and just talk about where they want to go in their own life. And so that's something we have tried to bring in, as well as training every single staff member on our philosophy. And so, Rosemary, there's one more question in Zoom, but do you have any from the Whova app?
We don't have any in the Whova app, so you can go ahead and do that one.
Okay, so this question from Jennifer may not be one that our speakers are able to answer just yet, but we'll give them a chance to answer it. And if not, I might want to open the mics and see if anyone else has some comments on this. Jennifer was asking, how have courts and legal partners responded to your use of mobility mentoring?
Yeah, I would say we're not there yet. I would also comment that by and large, we, the programs that are implementing mobility mentoring or are beginning to implement mobility mentoring in New York City are working with relatively lower risk families, meaning families that have a lower risk of return to the child welfare system, and in some cases, though very complex, less complex needs. And so they are also families that may be less likely to have a court filing. But all to say, a little bit too early for us to know what the response of those stakeholders will be.
So for us, we've given some preliminary thought, and we believe that it will be a big part of our work around messaging. So we would really have to spend a lot of time marketing, sharing materials with family court, making sure they really understand the transition that we're making. And so like New York, we haven't started that, but we have begun to think about, what that will look like, because it will also change how family court sends families to us. And then also it will change what they will look for in any decisions around whether or not the child returns home to the family. So this is a very important piece of work for us. And so we haven't talked with EMPath about it, but our thinking was, how are we partnering with EMPath to make sure that the messaging is there, so that when it's time to really address that, we're doing it in a comprehensive fashion that makes sense. And we're thinking about the outcomes that would make sense for family court, right? It has to be something really simple, and it has to align with child welfare outcomes. So we are looking forward to getting more direction from EMPath in that area.
Well, I want to pass it back to Liz because she's smiling and wondering if she's thinking the same thing I am. New York ACS has had to do a lot of work to educate. They have hundreds or maybe thousands of people that refer cases to all the different agencies that are funded to do this work. And they've had to teach them about how to make a decision about what kind of program to send these families to. So Liz, do you want to talk about that process? Because it's kind of similar that if you're getting referrals from a system, they need to understand what mobility mentoring is or whatever the model is. And how do you do that?
Absolutely. So I think there are two ways in which we're thinking about this. One, so as I mentioned, families don't have to have been engaged with a child welfare investigation to get our free services. There are about 75 to 80% that do come to us in that through that referral pathway. And there are about 20 to 25% of families that come to us through community-based referrals or sort of walk in the door. In both cases, referrers need to understand the model, to Ruthie's point. So for us, we have our child protective service workers who, for those, you know, that majority of families that are coming to us because they've had some allegation of abuse or neglect, are doing an investigation. Whether or not that investigation is indicated, meaning there is really a problem validated in the family that needs to be addressed, or the case isn't indicated in families, but families could still use some support. CPS is making a decision about should these families get referred for some prevention services? Do they need some support? Could they use someone in their home? Walking them through goal setting, making sure their children are safe, making sure they have their concrete needs set. And so then that comes to a team of referral managers who need to make a decision about, okay, if we think this family needs that type of service, which of this array of 12 to 13 different types of services should they get? So to Ruthie's point, that all requires those referral managers and CPS to be getting enough information about the family to determine what will serve them best. Hopefully, and we're trying to drive more and more towards this over the next few years, getting family preference about the types of services they want and need, and then making that referral. So there's a lot that happens before someone lands with a mobility mentoring provider. And so we did sort of extensive trainings on all of our models for all of those stakeholders, but specifically on mobility mentoring, and had the EMPath team come and really walk through what is the ideal family, what do services look like so that you can be talking to the family about what those services they might get referred to look like, and what happens sort of once they walk in the door to a provider agency. On the other side, where we're not getting families through that child protective referral pathway, we also need to make sure, and we still have a lot of work to do here, and Ruthie, this reminds me that we should talk about it, we need to make sure that our community-based organization partners that are offering other types of services that are touching families through WIC clinics and SNAP offices and community service provision also know that mobility mentoring is available in their community, and that families can get referred and walk in the door without ever having to become involved with child protective services. So yeah, it's really important, whether from the court angle or all the other places our families get touched, that we are making sure people understand the program, but as importantly, that they can talk about the program to families in a way that resonates and makes sense for them.
Right, it's really important. I mean, Lorraine, you probably deal with this a lot. You know, families have to do some very concrete things to reunite with their children. And a judge may not understand like what cleaning up my debt, how that might relate, you know, to, you know, why would that be a relevant goal to being able to reunify with your child? So it's a really different approach, you know, especially with the legal system where they're just really focused on the letter of the law and maybe not seeing the big picture as much. Yeah, go ahead.
Oh, I just wanted to respond to that because we experience that now. Parents come And they tell us, you know, I was referred here to do this service. And, you know, we struggle to help them understand and see the bigger picture that what we're really talking about is long-term. We're talking about family stability. You know, the information that you've presented here may say that you want to do a little bit more, but, and we get it. If the short term is for, I really want to do what I need to do for my child to return home, that's where they're focused. So, and now we're thinking about, you know, what is it that we want to do and how are we presenting the program in a way, but we believe the goal setting will give us the window to really talk about those longer term goals that we want them to have. It will just be manageable and short term. And then they will, as Liz talked about, they'll walk away with a longer term plan. So they may not do everything with us. They may just begin the process with us, but they'll carry this longer term plan. Yeah. It will also change how we deliver our services. So right now, once a person completes, we close them out at ARC. So we're thinking that they'll always be able to return to ARC. So in terms of how it has changed our organization, we're rethinking even how we deliver our services and what does close mean. So, I mean, introducing mobility mentoring is really causing us to rethink, you know, a lot of our current operational processes as well.
Wow, that's great. So we would have time for one more question if anybody in this participants wants to share anything. And if not, I see a few providers that I recognize who are just beginning to bring up mobility mentoring in the community. And I will give a gold star to anyone who will unmute themselves and maybe talk about what does it feel like for your staff and maybe even for your participants to be doing mobility mentoring in this kind of child welfare, child protection area. So Lorraine, I don't know if you have any of your colleagues on board, but I see at least one or two New York ACS folks, and they hate it when I put them on the spot, but it would be really interesting to hear from one of you.
Hi.
I knew you would do it, Sarita. Thank you. I was looking at you.
No, I felt that. So I guess, well, what Liz said earlier, where we were given 3 different models, and I chose myself and the executive director. Well, I was fighting for, well, I requested to have mobility mentoring because it kind of aligned with the disparities, as everyone else mentioned. And I'm so glad I did. We had a choice between, like, I guess, solution focus and something else. But I thought this one was best for the families based off of the work I've done with the families in the past, where most of the families come to the agency for assistance from shelters, and they don't really see themselves past where they are. And I thought this program would instill hope in those who were hopeless and also help them to the next area of their life. And I'm just so glad that we did, because it kind of, you know, like I said, aligns with the population that we service.
And do you want to give a shout out to your organization, Sarita?
Oh, Catholic Charities, Brooklyn, Queens. And also, because we have, to Liz's point, because we have our own WIC program, I'm also working with the WIC program that we have, which is totally remote, to see if there are clients that, or people that they service that can use our help as well. And, you know, other home base and things like that. So it's been very helpful. I don't have a lot of clients as of yet, but, you know, I'm getting the word out, and we're reaching out to people, and my team is so excited to start the work. I hear that every Friday when I have my meetings, how excited they are to start the work. We've been practicing on each other. We've been using it with the clients that we have currently, not so much with the ones that are closing out, but we do introduce it to them, and this way they can carry this on with their families and themselves. Thank you
so much, Sarita. Thanks. And Lorraine, did you want to call out anyone from your team by any chance? Or?
Well, I don't want to call anyone out. I'm hoping that someone would step up and make a comment. Okay,
let's-
it doesn't seem like I have any takers. Oh,
It's
wait,
okay.
there's one.
I'll comment.
Yay, James.
Hey.
No, I think I agree with Sharita in the sense that while we are fundamentally just starting this, there is a level of excitement because I think there's also a thirst for models that really support the whole person, and we found that EMPath is really one of the few models that we've seen where you can actually give people options and help them to understand how their decisions in all aspects of their life are sort of interrelated. And so we're excited. The rain's working me to death, but I'm okay.
Not surprised. Well, thank you so much to Lorraine and Liz. Really, really appreciate the time and effort you put into this. I'm going to ask Rosemary to give instructions to everyone about how to join our follow-up conversation. I hope to see some of you there.